Thank you, sir.
Morning, everybody. The chairman of the Government Service Commission, my fellow deputy chairman, yes, all the Owerri councillors for health, the HODs, and all delegates, vice chairman. I welcome also join to welcome you to this seminar. We are pleased to be here, not just to represent ourselves, but to have a little insight into the operation of the primary health care and we are preventive mechanism in Imo State. One of the greatest conclusions which I and maybe other chairmen have had is that the health department is rapidly becoming a mystery. We need the benevolence, goodwill, and willingness of the HOD health to explain to you how it's wrong. So, now that you have invited us, we will be happy to have first-hand knowledge and go to the students and accounting of candidates and the pupils, or even the primary health care itself, that are fellow local governments. So, thank you for inviting us. Maybe now also add that we are now having a lot of introductions. Before the real lecture will commence, there will be time for our lunch. So begin now.
Thank you very much. Everything you said well noted, sir. However, we may plead that we still hear from other people's goodwill messages, or we make it brief. We make it brief and straight to the point. Okay, permit me to now call on the Supervisory Councillor on Health, one of them, to give us their goodwill message. Just brief, so that we'll take your points. The Supervisory Councillor.
Let me stand on the already existing protocol. My name is Honorable Engineer Lucy Uji, the Supervisory Councillor for Health of our housing district local government. By the grace of God, on behalf of other Supervisory Councillors, we are saying this is a good mission, a good beginning. They say health is wealth. I think this is the first of its kind in Imo State, and we are here to say,
thank you very much. That was a good one. At this juncture, I want to call on one of the PSC coordinators, the leader of the PSC coordinators, to please give us their brief speech. A sound of applause, please.
Ndị eze ụnụ anwụtụle o, ndị eze ụnụ anwụ na ngwa ngwa, ndị eze biri kwenu. On behalf of the primary health care coordinators, I wish to thank God Almighty for this great opportunity. I want to thank our Honorable Commissioner, our mother, the ES, the Executive Secretary. She has been doing a great job in primary health care services. I must say that the traditional rulers, They've been father, a great one at that. They help us at the various communities, both in mobilization, in resource provision, and we must say you should continue. Our honorable members, especially the local government chairmen, we need you more than ever now, because health is wealth. We need your services, both in rehabilitation of the health centers,
A man I respect so much because of his commitment towards the promotion of quality healthcare services in Imo State, and a man who holds dear that ministry, ensuring that it is functioning efficiently from the top to the bottom and vice versa. The Honorable Commissioner, Ministry of Health, Primary Health, Health Insurance, is here in the person of Dr. Prosper Owerri Success. So it's an applause. Highly welcome, sir. Permit me at this juncture to also recognize briefly the Health Program Financial Management Unit, Accountant General's Office, Mr. Chinonso, Ms. Chinonso Odua. And standing applause, please. You're highly welcome. All right. I want to, at this juncture, call on, of course, a man whose what I may refer to as subjects have spoken. It's not for him to.
Have you done this? Let him speak.
To speak, talking about the chairman, Local Government Service Commission, who has been here all this while with us. Excellent applause as he takes his speech. Thank you, sir.
I stand on the existing protocol. I thank God for today. And I want to start by thanking His Excellency for his commitment in primary health development in Imo State, his commitment and assistance to the primary health agency. I also want to extend my thanks to the Commissioner for Health and the primary health agency coordinator. We appreciate everything you're doing in the local government. We appreciate, we know all your programs, and definitely you are going to save lives in various local government areas. I want to tell you that I have committed, qualified, and hard-working staff in the 20 women councils. I know what they can do, what they need to be directed. I assure you that all the program will have been doing it, and I'm sure they will continue to do it, they will achieve results. Thank you very much.
And I go back here, thank you very much, sir. It is now time to hear from our royal fathers. Yes, all of us belong to one community or the other, supervised traditionally by these royal fathers. But we now listen to them as I call on Eze Dr. Lucky Okoro to give us their speech.
Dr. Lucky Okoro will not talk now, I will speak later. The chairman of Owerri is here. He will speak on behalf of the shareholders. I'm part of the healthcare, so I'm interfacing between the service and the shareholders on Facebook. So, is the engineer, Sir Fred.
I will say good morning to all participants and organizers. I'm speaking on behalf of, and also all the people who are sitting on the high table. I think that's the high table here. I'm speaking on behalf of my principal, that is the chairman of Council of Traditional Rulers, who is not here today but represented by Dr. Lucky Okoro. I'm talking in person of Dr. Isi Okeke Ezimo. First of all, I will thank the organizers for organizing this advocacy. The need for this advocacy cannot be overemphasized because we are talking about primary health. Everybody knows what is primary. Primary is different from secondary. So before you go to secondary, you must get to primary. Primary is the palace of the Bible. It's like having a neighbor. The first person that meets you when you're in trouble. Primary health is where our people go. That is the rural populace. When we have primary health, the persons invited here, they have a very big task. Because we know that however we have the infrastructure or the staff, we need to get the trust of the rural populace to attend the primary health institutions. This is where the NGOs come in. Because we know that in the rural villages, they prefer what they call chemists to mix drugs for them than to go to these primary institutions, unless they are well educated on the services of this primary institution.
The Executive Secretary of the Primary Health and Development Agency, the LGA Chairman, President, Chairman, Imo State Government Service Commission, the Chairman, Council of Traditional Rulers in Imo State, heavily represented by His Royal Highness, the Lord Okoro, another Chairman of Council of Traditional Rulers in the 27 LGF, the Supervisors of Health at the 27 LGF, the MCDA coordinator in the state, the directors in the 27 local governments. I want to just permit me to stand on the existing protocol. Let me quickly, as directed by the Commission, tell you what in fact is all about. I think he mentioned, briefly the objective of our gathering here today, because we have identified all of us here as critical stakeholders as far as the impact project is concerned. So that is why we decided to bring all of us here to make sure we are all carried along as far as impact project is concerned. But before I move further, impact is an acronym, IMPACT, impact. It has a meaning. The full meaning of impact is immunization plus and malaria progress by accelerating coverage and transforming services. That is the full meaning of impact. So when you hear impact, you know that it is all about immunization plus and malaria progress by accelerating our coverage and transforming the service we render at the local government level.
But I know how to forgive it. There's a the Executive Secretary, Imo State Primary Health Care Development Agency, the Chairman, Local Government Service Commission, the Executive Chairman of the 27 local government areas in Imo State here present, the Supervisory Councillors of Health from the 27 local government areas in Imo State, the Chairman of Imo State Council of Indians, His Royal Majesty, President Dr. ECOKK CFR, represented by our own His Royal Highness, President Dr. Lord Okoro, and all Indians here present. The PSC coordinators, my colleagues, ladies and gentlemen. Today we gather to reaffirm our commitment to a fundamental principle in healthcare. Primary healthcare is the cornerstone of a healthy society. It is the gateway through which every citizen regardless of their location or socio-economic status, access essential health services. It is the foundation upon which a robust and equitable healthcare system is built. Primary healthcare is not merely about treating illnesses. It's about prevention, health promotion, and community empowerment. It is about bringing healthcare closer to the people, where they live and work. It is about ensuring that every individual has access to comprehensive, affordable, and quality healthcare services. To strengthen this gateway, we must acknowledge the critical roles played by our leaders. Our traditional leaders are custodians of our culture and community values. Our traditional leaders are vital in disseminating health information, promoting healthy practices, and mobilizing community support for primary healthcare initiatives. Your influence cannot be overemphasized. Your influence in addressing cultural barriers and fostering trust in healthcare services is invaluable. Hence, you're being invited today. Our dear local government chairman, you are the frontline administrators responsible for implementing healthcare policies at the grassroots level. Today, we have the local government autonomy giving you charge to implement the Abuja Declaration of 15% of your budget to health services. Your leadership in allocating resources, ensuring the functionality of all the primary health centers in your local government area, and empowering your healthcare workers, working closely with your PSC coordinators is crucial. Our primary healthcare coordinators are the engine room of our primary healthcare system. The healthcare workers in the local government are all essential. Your dedication to overseeing service delivery, coordinating community outreach programs, and ensuring data-driven decision-making is indispensable. Hence, today we are all here to discuss your role in the World Bank project called Impact. We must recognize the significant contribution of this project. This project, which is focused on strengthening primary healthcare systems, has been instrumental in improving access to quality healthcare services in most places, particularly for the vulnerable population. The project emphasizes on data collection and resource optimization and making sure that all the primary healthcare services within our reach get to the people. Your role in making sure that this happens is very important. Hence today we will be discussing the project Impact with you, and we'll have a chat to know how to go forward with it. I want to thank His Excellency, Distinguished Senator Okouzodi Masiowe, who has relentlessly made sure that this people-oriented project gets to Imo State. He has demonstrated an unwavering commitment to the health and well-being of the people of Imo State. This administration has made significant strides in revitalizing the health sector, with a particular focus on primary health care. Infrastructural development has been seen. Renovation and equipping of numerous primary healthcare centers will come up with this Impact project. Hence, it is your project, and you must take it as such. This administration has prioritized the recruitment and training of healthcare workers. We are looking at the gap in
about the full Impact project. We were talking about the immunization section. That the malaria section will come later, though it is within our state right now. And while you went further, you were saying that the women are also involved. But I want to tell you that these women, especially the pregnant women, need to be attended to. because most of these children in the stomach, in the womb, most of these children in the womb, they suffer malnutrition. Most of them suffer malnutrition because I remember how much there was one drug that was sometimes. It was too costly that most of them were, and when they are giving back to, that didn't affect them somehow. So while you are providing this thing for the women that have already put to bed, consider the pregnant women too, so that you provide some things for them and also provide some food items, especially protein food.
Ọwọ́ kì í kúrò kú, wẹ́ẹ̀ kì í kúrò kú dà. Ọgọ́ àwọn ejú òkú, yá àwọn ejú òkú. Eléyìí ó jì gé ejú òkú.
And within the period of 1 to 5 days, I think let me stop here.
Bàbá náà rí ní àwọn ọ̀gùn náà, àwọn ìbúrò ní àwọn ọ̀gùn. Ó rí rí ọ̀gùn ọ̀gùn rí kìí, ẹ̀dẹ̀ bọ́ọ̀rọ̀ àwọn ọ̀gùn.
Our project is not to provide food. These are injured and we're not here to debate. Your questions must be germane and straight to what we do. Our project is not to provide food. Our project is to talk about the practical service, promotion and everything. Food security, agriculture and food security has another sector. Please, and what it means, I need you all to know that you are in government now. So you have to understand that the government cannot do it alone. You must teach your people how to get back to the farm. Everybody must go back to become a farmer. And that is the only way we can have enough food in our place. Thank you very much. Secondly, we are not just talking about women that have given back. When we talk about maternal mortality rates, there are certain things that constitute factors that cause this maternal mortality, which includes complications during childbirth. And now I want to take you back. Everybody must know, and it's also a good thing. This is not the program for it, but I'm going to mention that we have the basic healthcare provision form. The basic healthcare provision form gives access to these vulnerable women, to children under 5, to elderly, and to all Nigerians. Hear me well. Pregnant women, indigent pregnant women, children under 5, the elderly, and all Nigerians. And please go and check every health center in your community. Ask the OIC, is there a basic healthcare provision fund service going on? It's a challenge I'm giving to everybody. Please, it's a challenge I'm giving to ask, is there a CPN going on in this facility? If your facility is a BACPM accredited facility, those people who are under that facility, there is a list that they have every day. PAC coordinators, you get to witness that there is a list given to those facilities every day, and those women don't pay 1 naira even for cesarean section. Those women don't pay 1 naira even for cesarean section. And we have achieved, please listen to me, we have achieved from health facility, can you listen please, so that nobody will vote me wrongly. We have achieved from health facility to secondary care facility where cesarean section will happen, 30 minutes knife on skin to delivery. And that's where I have given you that data, that of all the how many thousand cesarean sections we had last year, we only had one, just one. And it was because husband and wife were dilly-dallying to move from that health center to the secondary facility. Is that when we have these functional health centers, our health centers will be equipped enough to help us provide comprehensive emergency maternal and neonatal care services. Right now, they are giving us the basic maternal and neonatal care services, but they will be equipped enough to give us comprehensive ones, and also to identify the ones that should be sent to secondary care and tertiary care. These are some of the work plans that we have. And one of the reasons why we've called you today is to solicit your support for community participation. Without you, we cannot do it. Without you at the grassroots, we cannot do it. And that is why we are here today. Thank you very much, Project Manager. You have done well. I don't want us to be in a classroom. I want us to be in a very, sorry sir, I will get to the question. I want us to be in an interactive, engagement where you ask questions and we are able to answer for you to be able to carry this thing back. But I want to cast your mind back to something. Our human capital index, we are ranking 152 out of 157. We are fifth position from the FAC. That is really not good. We have every year 714,000 children who are below the age of 5 dying. They are not dying from accidents. They are not dying from things that you and I cannot easily prevent. They are dying from things like malaria, things like pneumonia, things like diarrhea, things that Harvard or Umochi will stop measles, sepsis. That is why you are all here today. We have parents who refuse immunization. We have parents who say, no vaccination to my children. But when there's a when the local government chairman when the PSC coordinators that they see every day when the churches preach about it, they will change their mind. That is why you're here. Thank you, and we'll give chance. There's an person that is eager to ask this question, and I'll give chance to question so that it will be interactive. Now, for anybody who is going to be presenting next, you only have 10 minutes to do your presentation. Make it simple and concise so that there will be interactive session afterwards. Thank you.
All right, thank you very much. I am His Majesty. This is the first MP to be appointed from Owerri West. In fact, my question is, this is a very important program about impact. We don't know what it is about. Most of the seminars or summits we attend, they prepare this activity so that we will follow it. And we are the people, the traditional rights and local governments, we are going back to the rural people to tell them what they are affecting. Especially the program coordinators at the we are not following. They should reduce this in paper and after coming up, we go back and study it and tell us this program. If not, program that
5%. We have the National Emergency Medical Treatment Gateway that gets 5%. And recently, because of what happened with COVID-19, we now have the National Center for Disease Control Gateway that gets 1.25% of that fund set aside for basic care. So this is a new system. Formerly, this is the traditional way of fund disbursement. from the national and the partners to the state, from the state to the local government, from the local government to the DSC. So they discovered that this system is producing inconsistent service delivery. There's irregular allocation. So they now developed this new system whereby we have fund coming from the national goes to a TSA account in the central bank, and through that account, the state funds the PSCs directly from that account. So we now see that we have more responsive service delivery. What is unique about this fund? Number one is the dedicated funding mechanism. We have additional fiscal space. We have at least 1% of consolidated revenue fund allocated to health. And the funding is expected to be channeled towards the delivery of primary health care. Number two is the demand and supply side financing. There is strategic purchasing of minimum package of health services. That is what we get from the insurance gateway. They purchase the health services we render to the people they have enrolled into the program. So there is also investment in the building blocks of the health system in a manner that improves the quality of care. That is why we are talking about revitalization of health facilities. Then there's enhanced coordination. Coordination from the federal to the state to the local government, even to the wards. We have WDCs that also play a role in coordinating the activities of the Basic Healthcare Provision Fund. So there's coordinated delivery of healthcare services. And we have robust governance and accountability framework. So at every level, we have governance, and that is how they are accountable to the higher level. So at the national level, we have the Ministerial Oversight Committee, which is headed by the Honorable Minister of Health. He oversees the activities of the NPSCDA, the National Health Insurance Authority, the National Emergency Medical Treatment Committee, and now the NCDC. At the state level, we have the State Oversight Committee, which is headed by the Honorable Commissioner for Health. So he oversees the activities of our board, the State Primary Healthcare Development Authority, the IMSHA, Imo State Health Insurance Authority Agency, and the State Emergency Treatment Committee, which is yet to be established in the state. And then the NCDC part, which is being handled by the surveillance area. Then under our own, the State Primary Healthcare Development Agency, we now perceive the arrow coming down to the Local Government Health Authority. At the Local Government Health Authority, we have oversight from the local government chairman, who are the heads of the local government advisory committee. So they play an oversight role on the local government health authorities. Then we now come down to the DSCs. At that level, we also have the WDCs. We play oversight role on the PSCs. So that is how the structure, the governance structure is. The Basic Healthcare Provision Fund will be financed predominantly by the federal government and disbursed through the 4 gateways I've mentioned. Let's go. So I mentioned the different levels and the roles. The Ministerial Oversight Committee advocates for allocation and release of relevant funding. At the State Oversight Committee advocates for release of 25% counterpart fund and also ensure that the implementation and use of funds within the state are in line with the guidelines. At the local government level, the advisory committee advocate and mobilize resources for 25%.
Do it well. We will have enough funds to actually take care of our people. Ụmụ nwanyị agaghị agbazi ọsọ o ruo n'ime abalị akụma ama m nwaanyị Chineke ji ntị mee ya imega n'ime nwaanyị eme onwe n'abalị ama m nwaanyị n'ime abalị. If you look at it very well, ndị nwe m, listen to me please. Hello. If you look at it very well, the reason is very simple.
Very simple.
The reason is very simple. I'm going to tie it down to maintenance of our facilities. The reason why immediately making Hanabali work, because Chineke Namasna at a time like this, I get with DFF. I with DFF. I get with small money. He's with solar lights. Solar lights are regularly 18,000. 18,000, 32 watts. 80 there will be constant lights. There will be constant solar lights in the compound up where every you can have panel outside. You can just put the panel outside to get the lights inside. Corona Bali, Imewe wine, and Hunzo is a one. Please let us look at it very well. Let us all be stakeholders indeed, not stakeholders on. Let us carry our royal fathers and our executive chairmen along. Let us carry our royal fathers and our executive chairmen. By the time this is done, believe you me, in the next time we are going to call stakeholders meeting, what we'll be asking for will reports from each of the local governments. Thank you very much. God bless you. Please.
Health Center, the Deputy OIC, the World Development Committee Chairman, and the World Development Committee Treasurer. Those two are from the community. The other two are from the health facility. So this is done so that the community will know what is going on in the facility and they are carried along. We ensure that payments are made through transfer so that we can track the funds, how they are using it. Develop annual quality improvement plans, quarterly business plans, based on the baseline assessment and verification exercises. They transmit their quality improvement plan and business plans to the local government. The local government will look at it, approve it, and send to us. We'll look at it at the state and approve, and then transmit to the nation. So that is basically what we do. Let me remind us again of, okay, this is the process. Before any facility is enrolled to receive funding, there has to be baseline assessment of the facility. This is for the state. For the facility now, there has to be a baseline assessment. So when they are approved, when they meet up with the human resources for health requirements, equipment requirements, and infrastructure, that facility is now approved and they are now asked to open an account. So when they now open an account, they now start developing quality improvement plan, quarterly business plan, and submit to the state. We now pay them every quarter. So the money that is paid to them are expected to be used for drugs and commodities, procurement of seed drugs, laboratory agents, treatment commodities, consumables, procurement of detergents, disinfectants, bleach, ad hoc human resources, transportation, utility and maintenance, waste management, fueling, stationaries, meeting support, and bank charges. Initially, we started with about 266 facilities in the state. After some time, they increased it to 305 facilities. That is in all the 305 wards in the state. Today, about a few days ago, they have also approved that 327 PHCs in Imo State will be receiving DFF. And every quarter, for now, they are getting 300,750 naira every quarter. So as time goes on, they will increase the amount. Thank you very much.
Thank you, Dr. I have to stand up because if you allow him, he's going to take us all round and round and round the basic healthcare provision fund. But I want us to go back to something. The use of the DFF. No? The use of the DFF. The function. No? Yes. Everybody here should look at this. The DFF is meant to make sure that there is no facility you will get into and you will say, I don't have drugs. Please think about that. I don't have drugs. There were drugs out of stock. They don't have cotton wool. They don't have bandages. Any facility that is a marked basic healthcare provision, you're blocking some people, please. Yeah. Please, can you come this way? Please, any facility that is earmarked BHCPN, local government chairman, Ndezi, supervisory councillors, any facility earmarked BHCPN must not say there was an outstock of drugs. They have money every quarter to provide for drugs according to what they have given to us as their business plan. Please, I'm saying this because you need to hold them accountable now. I'm saying this because some people think that that quarterly money is their personal money. I need us to all understand this. These facilities are your facilities. The onus is on you to liaise with your supervisory councillors and the OICs and have a one-on-one true advice to the executive chairman. But remember that the owners of the communities are the traditional rulers. They must carry them along and let them know what is happening. Thank you very much. Thank you very much for your presentation. Sister, I know you are eager to say something. Okay, let me just allow you to say before.
Hello. I just want to add or make a little emphasis on that money because having complaints regarding that money, when we call it 300,000, you will think that the money is too much. But remember, it is quarterly. If you divide it, it's like giving them 100,000 to maintain the facility for a month. So that when you look at it that way, you will know whether there is money or not. you should aim to contribute to what they are doing at the facilities and not fighting with the OICs. I know why I want to emphasize on this, because WDCs,
yes, there are problems. The WDCs.
Difficulties, a lot of problems, complaints about the WDCs. Sometimes they coerce the OICs to get that money for sharing. That money is not for sharing. That money is meant to improve the life of our people. So if you go and bring out that 100,000 and share it, what use is it for? So please, I am emphasizing on this because while it is an eye-opener to some of you that this kind of money is coming to your domain, just know that it is not something to go home to fight for. Rather, it is something that when you look at it, you want to contribute more. But to ensure that even if it is a penny that is given to the facilities, that money is used judiciously. That's your oversight function. Please. And the Commissioner has mentioned about the work of the chairman. The facilities are yours. When we came on board, when I was making my tour around, there are facilities you go, you weep. Yes. You weep for the people that even attend to those facilities. Because when you go there, I ask, why is this? All the roof is gone. And the OIC will say, we've been writing. We have written to the DAT. And the DAT said he has told the chairman. And at the end, nothing will be done. One roof will fly off until all of the roof is gone. Still, people are coming there to access health. So it's really a shame for any community that has that kind of facility around them. So please, my honorable chairman, again and again, when you go home, please make a tour, visit the facilities, and if there is anything you need to do, do it. Because we need to improve, upgrade our facilities so that our people will be confident enough to access health in those areas. What we give if people there, just run away. So please let us take it serious. We can understand when maybe there was no money coming to the LGA chairman. But now that you are autonomous, please let there be a difference. Thank you very much.
Thank you, sister. Hello. I was being a bit careful with my use of words when I was talking. The sister hit the nail on the head. Most ward development chairmen are our issues. And I will not, till I am removed or till I finish serving as the commissioner, I will not stand any ward development chairman who is asking for the money that is meant to improve quality of care in our health centers to be shared. Let me categorically tell you that I have had a reason to change WDCs as signatories of this deal.
Most states now offer this immunization 731. The whole facility now immunization. And for the year 2025, 277, 478 children under 1 year. Can expect it cover by her own body. Can go till a 1 year. Next slide, please. I person more 4 times in a month. So from our data, across all LG and the mega 4 times in a month for our fix and outreach community community by community gba chọọ ụmụaka na-agba ọgwụ gba ha ọgwụ. And from our data, Osun, Owerri North, and Okigwe, a na-emepe facility that up to 4 times in a month agba ụmụaka ọgwụ mgbochi. Mana other LGAs niile na-eso that usoro national. Next slide.
Security.
Ọgwụ mgbochi ekwesịrị inwe ndị na-aga eme supervision, ndị ọrụ ha bụ ị na-echekwaba maka a na-agba ọgwụ mgbochi ọfụma, a na-akpọ LIOs, MIs, LGA. Other than minimal supervision, most of our people are not getting supervised because if supervised here, make sure that the health workers they are all NOTC now our listing, no sort of 4 LGAs, Mundi Nanda International Sina, Sikaigazo, Ike Duru, Ida not Kubuta no Haji. The supervisors now go work now and make sure now every week na LGA. Mana ndị nke na-aga mgbe ọbụla bụ Owerri North, Owerri West, ha na-ebe ahụ. Next slide. From our data, enwere antigens ọgwụ mgbochi na-agba ụmụaka Beta-1, PCV1, Bota-1. And then we coverage, national Cairo, 85% in coverage. And Erube, as a state, Imo State, Erube, that coverage. We have not met the coverage at all. Meaning that most of our children, and then when some LGAs near Erube, most of the LGAs, Erube, that data, Erube, that coverage. And I say also, my job present here, who may encourage our mothers. Next slide. For the coverage, also some E2 bomb, Bierugo, 85% coverage na the whole of Imo State. For this PCV1, PCV2, Pensa, also see E2 bomb, we go that 85% coverage. You check there. Next slide. Next, all the same thing. Next slide. They don't work on a wall and keep my watching work until 9 months. Measles, May, na yellow fever. Other LGAs were every day that coverage apart from E2 bomb and Bambo. When they mention that ndị na-afụ ọgbakọ ọgwụ mgbochi a na ụmụaka na-aga megide agba ndị YouTube bụ eruola 85% coverage, ndị nkwere na ndị ọrụ Imo eruola that coverage. Ha na-aga anyị na-asị jide uru gịnị okay, and then I drop out rate. Drop out rate ụmụaka bidoro okay, and then I drop out rate. Yọpụta ụmụaka bidoro gbamụ ha agbala penta 1 penta na abịara bịa gbazuo ọgwụ mgbochi ya. A lot of years abịa when high drop out bidoro they were the highest dropout rate in Imo State for the past 2 years now. And the funniest thing, let me go on our town.
Imagine security is there now.
The person that with this problem. So I know what the HOD, my room chairman, everybody can encourage can now put that. And that's why the first when I know the down. No a lot of reasons. Maybe the health worker and impolite. Maybe I have vaccine maybe I also didn't want but major thing, AJ can encourage and the every with the highest dropout rate, followed by Indiaba, then followed by Ayas. Because the kindness of our highest dropout now LGA, highest on that immunized. na the whole Imo State. Anyị nwere Osun, which is the highest, followed by Ayam, then followed by Nwa.